Hello and welcome back to Tea Talk. It's going to be an exciting night. We have so many different topics, a lot of context. We've got Lisa Z, we've got DaBoss, we've got Jinx, and behind the curtain, we've got Phantom. Tonight, we're going to talk about the big, beautiful bill. We're going to talk about taxes. We're going to talk about chaos in the news. We're going to talk about chaos going on in Los Angeles. What is the Trump administration really trying to do? We're going to talk about Kilmar Brega. We're going to talk about a lot of things, but most of all, we're going to give you a lot of context, a lot of information, things that's going to help you to know about what things are going on for you and where you live. So sit back and enjoy Tea Talk.
1, 2, 3, 4.
Welcome to Tea Talk on the Pod, a roundtable of opinions and facts where politics are loud, news, it's sus, and the entertainment, it never stops. We have DaBoss, the pillar of substance and truth. Jinx, the voice of reason, wisdom, and a lot of sass. Lisa Z, the statistician of facts and tracks. And me, well, I'm T, the instigator, the protagonist, and I bring the heat, the heart, and the soul. Welcome to Tea Talk. What is the implications of this bill for healthcare and other social safety net programs? But before we do, I want to get your take on the whole Musk and Donald Trump love disconnection. What are your thoughts and what are the implications of that in the country? Or is it just a look over here while we do this over there?
I actually don't think it's a distraction. I mean, normally I do. Normally I think anything that they do is a distraction. But with this, I think that it was inevitable. I think you have two narcissists, two people who think that they rule the roost. And you had Elon Musk coming in there as a shadow president. And we all know, regardless of what Trump said and the buddy, that he did not like that. He did not like people calling him shadow president. He did not like Elon Musk swinging his big old chainsaw around and making trouble with the cabinet officials, right? And so it was only a matter of time. Elon Musk was bringing down Trump's approval rating like a rock. And I think when Donald Trump said, I asked him to go, I think he did. I think he did tell him it was time for him to go. What do you guys think?
He was bringing his stocks down too.
Yeah, well, yep. Well, yeah, Donald Trump was bringing down Elon Musk stocks. Well, what
Absolutely.
do you guys think?
To the tune of $47 billion last count I had.
So, I mean, like you said, I saw this, it was like a train wreck you couldn't look away from. And it was instant that we started getting the vibes. And I know they did, but they didn't, they couldn't say anything. But the second people started calling him the real president, the second he was put on Time, wasn't he on the cover of Time? Sitting behind the desk. It's like, oh, he's not gonna like that. Buckle up.
We know what happened to Bannon, right? In the first term, same thing. That's what I said.
Right. I think that they who knows what goes on in the mind of malignant narcissists. But it was a perfect storm. It was a perfect storm.
For sure.
It was just taking bets on when it would finally hit the fan.
Sure.
Yeah.
Sure.
I think there were some trigger points and moments. I think when Elon came out and said that he wouldn't have won without him, I thought that was a lot of people were saying
gave numbers.
Yeah. Well, see, and that's where I was going. TC when he said he wouldn't have won without him, he said if it wasn't for him, the Democrats would be in the House, would be in control. They'd be in control of the House, and then the Senate would be a 51-49 split, right?
That was so specific, right?
Right. It was too specific. It was, from my perspective, he was literally telling us what we have already been thinking.
Right.
Because how would you know where that split lied if you
Yeah.
don't, if you don't believe that your influence moved the needle specifically somewhere to get to that end result?
Well, I got some real good tea, and it's not good for the American
Yeah.
people, right?
Yeah.
So we know that this bill covers a multitude of sins, or I should say uncovers a multitude of their sins, and just how much they really don't care about the American people. You've got children and dogs and a spouse and a job and all of that. No one has time to weed through all that, and they know that. So that's why we've done it for you, folks.
Yeah.
So buckle up. This is not good. So when we talk about the social safety nets, we're talking about Medicare, Medicaid, the ACA or Affordable Care Act, and SNAP, right? So the biggest portion that looks to be impacted is Medicaid. Billions and billions and billions of dollars they want to go for Medicaid. And remember when they said, no, we're not doing that. No, we just want them to find the waste and the fraud and just, like lean it out, right? But no, we told them absolutely not. We're not touching Medicaid. We're not touching Medicare. We're not touching Social Security. We're just it's gonna be fine, y'all. Well, there are 83,122,000 United States citizens enrolled in Medicaid.
Wow.
Right?
Wow.
In the US, of those 83 million people, 39% of them are children. 63% of them are nursing home recipients or residents. 41% are births. Right? And 41% are working age adults with disabilities. Now, I landed with the working adults. 41%. What is the first thing that people think of when they hear Medicaid?
They think of people sitting around, right?
Yeah,
not doing anything, not working. They're just sitting around collecting benefits, right? Welfare queens.
That's right. Well, with 41% of the country and that's just of working age adults with disabilities. That doesn't count underage people under 18, kids my son was one, kids who have jobs, but with disabilities. That's not even counting them, right? So it's just really stark how how cavalier they are with the things that are literally keeping people alive, right? So the CBO estimates that 8.7 million people would lose coverage, 7.6 million more uninsured over the next 10 years, with, we know, rural areas being hit the worst. So it just seems like you said, Lisa, it's the cruelty is the point of it, right? So that's where you want to start.
And I'm going to assume that those rural areas are in predominantly red areas, maybe?
I would hazard a guess that you would be right, T, right? So the first thing I want to talk about under these conditions that they've put around it is work requirements. All right. So they've decided you lazy folks are going to have to get up off your duff and you're going to have to go to work just like I do. So people in the United States over 65 years of age are required to work 80 hours a month, be at least half-time enrolled in an education program. There are some stipulations that you can do volunteer work, but you have to be doing still 80 hours, and you can kind of mix and match some of these provisions, but 80 hours a month that you need to be out off your duff and working for the people's money, right? They have made it so hard, and they think that this is going to make people work more. But the studies have shown that the more you force people to try to work and hold a job for threat of losing their health insurance, there are too many barriers that they've put in place that make it hard for that to happen. right? So there are people who don't have access to the internet. There are people who won't get their notifications. And these are changes that are being made from the other requirements that there were. So they have to get notifications when that's going to be, when it has to be in. They have to report their working hours or volunteer hours or school hours every week. What if they don't have a computer, right? All of these things. They're caring for somebody else. They can't do that. And so what does that do? That puts the onus on them. We didn't take their Medicaid away. We didn't take their health care away. They just didn't meet the requirements. And I guess maybe it wasn't as important to them as we thought, right? But studies have shown that people who have access to health insurance and health care that they can afford are people who hold a job. They maintain a job. If you cannot jump through all these hoops, not to mention the prior authorizations that you have to get in order to verify your enrollment, in order to stipulate that you have all your ducks in a row, if you're doing all of that, so they're making it so hard for people to be able to do this. And so when they fall off the rolls because they missed a deadline, now what is the reality? What is the reality of that? Right? The reality is now you have someone who is unemployed and uninsured. Because chances are
And what people
they're
don't
not going to be able to keep
understand,
their job. If they're sick, if they can't make it to the doctor, if they can't go to the hospital, if they can't access healthcare when they're sick, they're eventually going to lose their job if they can't go to work. Now unemployment is on the rise. Now people are going to ERs and racking up that cost. And now those
and what
costs
people
are going
don't
to be
realize
written
that,
off.
Gene, on that point, what people don't realize, when people are thrown off of healthcare and people lose their healthcare and their insurance, and they have to seek, whether it be emergency medical issues or whatever, to a hospital, when the hospitals have to cover that, because no hospital can turn anybody away. That's what people don't understand. Those are the things that's going to make everyday regular people who have their good insurance plans and all of that. That's what's going to make your premiums go up, because now you're going to have to subsidize all of the actually free healthcare that people that were knocked out of the system are now having to rely on in the hospitals, because we can't turn people away, at least not yet. I hope we don't get to that. And I think that people don't understand that that's where every American individual that has good old basic insurance through your employer or whatever, that's going to make your premium costs go up. People tend to forget that.
Right. So your premium costs are going to go up. And then if you don't qualify for Medicaid, then that's low pay insurance. Then you're not going to qualify. You're going to be no pay at the hospital. Right. Correct. So you're not going to pay your bills, which means that overcrowded ERs are going to be more crowded. The bills aren't going to get paid. The hospitals are going to have to write it off. And what's going to happen? The hospitals are going to close.
Yes.
Right. We've lost
especially
two in my area.
Hospitals.
Exactly. Especially rural hospitals. My area, which isn't rural. And we've got hospitals like, here, there, and everywhere. But 2 of them have closed recently. And I have a relative in the hospital now. She was in the ER for 2 days because they didn't have a bed for her.
Wow.
Yeah.
Wow. 2 days.
That's horrible.
2 days. And this woman was a federal employee for 38 years.
So she has really good insurance.
Great insurance.
She has the best insurance that you can have in this country.
Wow.
Right.
Wow.
So
yeah, that's not alarming for anybody out there listening, is it? That's not alarming at all.
Right. And that's her, right? So you're talking about somebody who has, like I said, the best insurance you could have in this country, and she had to wait 2 days for a bed.
Absolutely. I mean, they did the best they could. And when I went to see her last, the nurses were a little grumpy and folks were on edge. And I said, listen, I know you are understaffed and over-patiented, right? You've got more patients' bodies here than you have staff. I get it. And then I asked, for what I needed, because you can just see that the stress that they're under, right? So these are all ways that they are harming people. But the other part is that it's going to harm the states, because all of this verification that they're asking people to do is not just on the patients, it's also on the state, because they have to implement these new systems. They have to hire new people. They have to train these people, right?
Right.
And so that is cost that's going to the state, additional cost that's going to the state, right? So
Right.
instead of them paying money into better healthcare, they're paying it to the Fed. Like, how does that serve the people, right? It doesn't seem like it does, right? So that's Medicare, Medicaid. The CBO in 2022 showed that increased work requirements are less likely to lead to more employment, and more likely to reduce income and benefits, which will lead to higher unemployment.
Right.
So it's
Isn't
so many different ways.
Jinx, isn't it something like 70% of Medicaid, adults on Medicaid are working, right?
Absolutely. 70% of adults on Medicaid are working in the United States.
And most of the rest of those are disabled.
Yes.
Yeah. So they're people are already working if they can work,
Correct.
or they're disabled, right? If they're not working, it's because they're disabled. And you're going to have people, all of them, right, eligible, all of them in need, right? Not fraudulent, nothing, but they're going to be kicked off the voter rolls because they didn't fill out a piece of paperwork, or they forgot to submit, because they're going to have to submit every 2 weeks, every month, proof that they are working, proof that they are disabled, proof that they volunteered, or whatever the case may be, or that they're in school. And so if they forget, or if they miss a piece of paper or miss a deadline, now they're off the voter rolls. And that's what the intention is here, right?
Absolutely.
The intention, that's how they plan on cutting Medicaid without cutting Medicaid.
Right. And what about elderly people? Elderly people that may not be living in some kind of a facility or something, but are still trying to manage their life in their elder years, to be able to have the wherewithal to keep up with all of this. And then when you miss one time, and of course everything is done on the internet, and all of you being my friends know that I am the most least savvy internet tech guy in the world. It is the least of my wheelhouses. You all hold my hand daily to walk me through just what we're doing now. But I mean, we have to worry about those people, because it's going to be so easy for those people to slip through the cracks because they don't have an advocate. Who is going to be the advocate for elderly people that are still trying to live and function on their own to keep up with this? Especially since half of the federal government has been fired, and you can't just pick up the phone anymore and find somebody. You can't even pick up the phone and call to check on your Social Security. Who's helping these elderly people? I think that's a huge question that needs to be answered. And I think, they take a broad brush and wipe these things out. Either they completely don't care what the effect is going to have on you, or they're just completely oblivious to the effect that it's going to have on you, in which case both of those scenarios are not good for anyone. Agreed?
I don't think they care.
Right.
They don't care.
They don't care. So now take those people, because you don't have to lose it to think about it. That's why we're doing this conversation now. So now people are trying to ascertain what they have, the who's, what's, whens, and whys, because it's real now. It's real now. The only thing preventing this from being a reality is the fact that the bill hasn't passed yet.
Correct. And I just want to go back and clarify something. So it's 20,272 people that are covered by Medicaid expansion in the United States. The CBO is estimating that 8.7 million people would lose their coverage if it passes as it is. 7.6 million more will become uninsured over the next 10 years.
Okay, so and that number is close to the website AmericanProgress.org. I think their numbers are very close. To
this is from KFF.org.
So now we're talking about millions and millions of people going. Now they're trying to pick up the phone, get online, understand what their next move is and how they're going to get there.
Yeah.
This isn't something, and then the people that are picking up the phones, the people that are facilitating these inquiries online, they're not staffed properly. To your point, Jinx, they're not staffed properly to handle it. And the sands and the hourglass are continuing to run.
Right. So there's one more thing that I wanted to say about Medicaid before we move on, and Medicare is it's really just the verification process. There have been some improvements, right? Like, so the last administration was able to negotiate some drug prices. This administration kind of undid that, but they're redoing it. They have made an exclusion for orphan drugs, which is a specialty drugs. Anybody out there listening knows what that is. If you're on it, you need it. It you'll be good with that because they used to not fall into the negotiation. So that will be there. But a lot of people out there don't realize that people on Medicare, oftentimes Medicaid contributes to that. They think Medicaid is just for broke folks.
Right.
And it's not, right? There is, if you are a low income earner on a Medicare plan, but your income is at a certain percentage of the poverty rate, you can get qualify for a Medicaid plan that will help you pay for your Medicare premium. There are so many. That's why that number for senior citizens in the United States, it is 63% nursing home residents covered by Medicaid in the United States. Because if you've ever had to deal with a situation for yourself or someone that you love, they've saved up all this money, they have decent insurance, and then I don't care how much money you have, unless you are truly the top 1%, and you're not going to be able to continue to pay. Nursing homes, people have no idea how many thousands of dollars.
Outrageous.
Because it's not just, you think about your rent, but
outrageous.
this is skilled nursing. You have doctors and all of that, right? So
around the clock,
over $10,000 easy a month. Your insurance covers a portion of it, but then you have to spend down your savings, and then your Medicaid kicks in.
Yes.
Right? This is important to more people than people realize. Absolutely.
Yes.
So yeah, the ACA, the changes that we're looking at are going to be changes in enrollment. It used to be year round. They've made changes in your, if you get married, you have a lifetime, a lifestyle change. If you get married or you have a child, that window is now more narrow because of this bill. Right? It's also going to activate, because of all the spending that's going on and the deficit going up, it's going to trigger something called pay as you go, which was something that was put in place to caution folks dealing with the money, like spend wisely, think about it, because once you reach a certain threshold, you're going to trigger pay as you go. So now that we've seen the projection is $2.3 trillion, right? Added to the deficit, that
over 10 years,
over 10 years, that has the possibility of triggering this pay as you go, which will automatically slash $500 billion from this program.
From Medicare,
From Medicare, yes.
That's incredible.
So it'll automatically slash it out of the program as you're continuing to raise the deficit to $240 billion.
Correct.
Every year.
Yeah, it's not good, guys. It's definitely not good. And then we've got SNAP, which I always thought SNAP was up underneath of Medicaid, but it's not. It's separate, right? So this bill, if it goes through as it is, which we're all praying that it won't, it's going to remove the threshold. It's going to remove a lot of things that would help you to qualify for these supplemental nutrition. I forget what the full thing is. Supplemental nutrition. I always forget what the A is. Program.
Supplemental nutrition
assistance program.
Yeah.
Right. So you have to qualify. You have to give them your household income, and because had SNAP. So they're removing the household threshold for a lot of things. The internet, you're not getting that deduction anymore. It's going to impact LIHEAP. I had LIHEAP. LIHEAP is a grant that it helps you with your energy costs. That's something that I have heard people talking a lot about.
I don't think I've ever heard that word before.
Yeah, it's LIHEAP. Bad on me for not having it all
having
out,
the acronym.
I look at it and I just know what it is.
Interesting.
I literally was looking at that the other day.
Yeah, it's very
energy
helpful.
assistance is so helpful for poor families.
Right.
It keeps the lights on.
It
keeps the heat on in the wintertime. You know what I mean? So people aren't freezing to death.
Yes.
It's essential, and you don't understand It's a lifeline for poor people, right?
Mhm.
It is a
Mhm.
lifeline.
It really is. The age restriction to receive SNAP benefits
Mhm.
used to be 18, right? That's reasonable, right? For
Right.
those of us who have kids, it's now 7,
What?
not 17, 7
7.
to qualify. Yes.
You gotta be 7 or
Can you say
younger.
that part
7 or
again so
younger.
everybody listening can hear that? Say that part again, Jinx. I want everybody to hear that number.
You will only qualify for SNAP benefits if you have children, right? That's part of it, but only up till they become 7 years old.
We have kids now that only get one hot meal a day.
Mhm.
Right.
Absolutely.
They
And
only
now
get
with
one
summer, they're
hot
not
meal a
getting
day.
that.
Right.
Mhm.
And I
to
mean,
your
we
point,
also think about that when we're eating lunch this summer, that there could possibly be some children in the United States of America
United States
going
of-
hungry because they're not going to get a hot meal because so many cutbacks and
Mhm.
taking away from people who
They
really,
already
really
cut that
need it.
program.
Well,
Mhm.
I was going to say, thanks for teeing that up for me, T, because the last provision that I'm going to mention about SNAP is that it would eliminate the nutrition and obesity prevention grant education. So these programs that are helping children learn how to properly eat, learn how to, because we understand that childhood obesity is an issue.
Sure.
It's like they're just hitting you from all sides. They're like, well, if you're overweight, I got a plan for you. Right.
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 They're like,
Mhm.
if you don't, if you're eating you want those expensive vegetables, I got a plan for you.
Yeah, it's called "We're going to starve you to death."
Yeah.
Mhm.
Yeah.
Yeah.
SNAP. It's called SNAP Ed, SNAP-ED, which is
Wow.
Nutrition and Obesity Prevention Grant, which teaches children how to, and families, how to eat properly, how to avoid some pitfalls. And yeah, they figure you don't need that.
Yeah, no need to have that when we just take the food away, right?
Right.
Wow.
Not surprised.
That'll solve the obesity epidemic. Yeah. No
Right.
food.
Jinx, you never disappoint. When I ask you to give us some information to do a little deep diving, I can always rely on Jinx to bring up the facts and tell everybody what's going on. And I want to thank you for this huge, huge segment that we just did in educating on and educating us on what is happening and what the potentials of this bill will be for so many people. And I hope this will be informative to them. I hope that it will help them. And God forbid this thing does take hold. I hope that people that hear this will maybe start now to try to find different avenues to get themselves help to where they can be secure in their lives and in their needs, in their finances, in their insurance, in their food and nutrition. All of this is so vitally important. And it seems to me, I think people really forget how connected we all are. We are truly all connected.
So now that the bill has passed the House, what can we do to stop it from actually becoming a law? So before it can become a law, it has to pass the House, has to pass the Senate, and the president has to sign it. Well, right now the Senate has the bill and they will make their changes. They've already said that they are doing that. So they will tweak it, they will take things out, they will add and change things, and then because they made changes, they will have to send it back to the House for another vote, and then it'll have to go back to the Senate after they make their changes. It's a whole process. So there is still time to reach your congressperson and your senators to tell them to vote no on this bill. Okay? You can call them once or you can call them every day. You can call them twice a day. You can send them emails. You can show up to a town hall or a protest. You could tell your friends and your family and have them call their representatives. You can join a group. You can organize. You can go and make posts on those representatives' social media platforms. Do whatever you need to do to make sure that they know in no uncertain terms that you do not agree with this. The phone number for the Congressional Switchboard is right there on the screen. It's 202 224 3121. That's 202-224-3121. You call the switchboard, you tell them where you live, and they will connect you to your congressperson and your senators.
I want to say thank you to everybody. I hope everyone that has watched the kickoff for Tea Talk will be repeat offenders and keep coming back. I want to thank Lisa Z. I want to thank DaBoss. I want to thank Jinx. But most of all, I want to thank Phantom. None of this would be possible if it wasn't for Phantom. He is our tech guy, our IT guy. He is the guy. And he is the one that has made Tea Talk possible to come to you. I hope this will be a learning experience for all of us. I hope that everything that is discussed, we all take something from it. And I hope that it makes us all better people, a better individual. And I hope that we can take that betterness and spread it around to others and let them know everyone is welcome here. Again, I want to thank you for Tea Talk, and we'll see you next time.
Hey, it's me, Phantom, the IT guy, reminding you to hit the like, share, and subscribe button below this video. And don't forget to leave your questions and comments for us down below. We'll select a few questions or comments to share and answer on our next show. Thanks again for watching, and keep an eye out for our next episode.
3, 2,